Hi, this is Ezra Nucci-Nemeth. This is my poster presentation for Psychology 180-60 for Chapter 14. My poster presentation is about schizophrenia. So the main idea is that schizophrenia affects 1 in 100 people. These people will suffer certain effects of this mental disorder their whole life. The title is Schizophrenia. The introduction is schizophrenia is a mental disorder that can have many horrible characteristics. Psychologists have to give professional diagnosis to this disorder. The results of this, if you are diagnosed with schizophrenia, recovery is very slim, unfortunately. Symptoms vary person to person, and I'm going to discuss how schizophrenia can affect people differently. So, schizophrenia is defined as a disorder characterized by delusions, hallucinations, disorganized speech, and inappropriate emotional expression. So the word itself is broken down into 2 different words. Schizo means split, and phrenia is mind. So people who have schizophrenia suffer from not being in touch with reality, I guess. They're split from reality, yeah. Schizophrenia is a lifelong disease that one out of every 100 people will get. Recovery is very slim. If it's caught early on, it can sometimes be recovered, but if schizophrenia sets in slowly, it's very, very low chance that recovery is possible. Acute schizophrenia, that can be recovered, but most schizophrenia, you can't. There's no treatment for it. Medication does help. With medicine, about 40% of people will experience periods of normal life, but only 1 out of 7 people actually recover. So a common effect or symptom of schizophrenia is actually hallucination. And hallucination is anything that is like something they hear, see, feel, taste, smell, basically your senses. It's anything of those, but it's only in your head, so you only see it or smell it or feel it. It's not real. The most common hallucination is auditory, so people with schizophrenia will often hear voices in their head telling them to do something, or basically making fun of them. Sometimes these voices will tell them to harm themselves. But yeah, like I said, the hallucination is different from person to person, and it's really interesting seeing people who have schizophrenia paint what they hallucinate, because it's vastly different, and yeah, it's really cool. And then disorganized speech basically is that people cannot focus on one topic at one time, so their sentences come out all slurred with different words, with different ideas. This is called a word salad, because all of the different words from their different ideas are just coming into one sentence, and it just doesn't make sense. And then another side effect or a symptom of schizophrenia is the fact that they cannot really empathize with people. They can't really feel sympathy, and they cannot really express their emotions, or if they do, it's normally not the right emotion for this specific time. So like, if somebody dies, they might laugh or be happy about it, when in actuality they want to be sad, but they just can't express it. And people really with schizophrenia cannot read facial expressions as well, and they have a hard time sympathizing. And yeah, I guess that's it. Thank you.